A common question I'm asked is, how can prolotherapy help a pinched nerve? Most people have a pinched nerve only certain times of the day. A good example is me. I've had 2 pinched nerves. Both times prolotherapy has resolved it. I like to term it positional radiculopathy, or you have a pinched nerve with a certain position of your body. My pinched nerves occurred in my neck. So when I recently had a pinched nerve, the only way I could find relief is if my neck was pointing down, my head was pointing down. And then when I was in this position, I would get a zooming pain down my right arm. So it meant that where the nerve root comes out, it was getting pinched when my head was back, or else my head was turned to the right. So anybody who has a pinched nerve when they're in a certain position, but another position like laying down, they don't have a pinched nerve, it means that you have joint instability. Like, in other words, there's too much movement of one of my vertebrae when I go like this or when I go like that. It was then closing off where the nerve comes out. So that's called positional radiculopathy, and that's what was causing my pinched nerve. To illustrate this, I'd like to use a model. This is a very, very good model of the neck. This is your head bone or occiput bone. This is C1, this is C2, this is the 3rd cervical vertebrae. And if you look on the side here, you can see these little holes. This is where the nerve root comes out. So in other words, when a person's turning onto one side, like say, this is an exaggerated example, but say when a person turned their head and this vertebrae moved too much, it's going to pinch the nerve like right there. So, boy, this is hard. So prolotherapy, by doing prolotherapy in the back of the neck and then causing the vertebrae then to move more in unison, the radiculopathy goes away. So my last pinched nerve, I just needed 2 visits of prolotherapy. I got a couple of massages, got a few visits of acupuncture, but as far as like stabilizing the neck, it was the prolotherapy that did it. So there surely are going to be times where somebody has pain all the time, like there's not a certain position they can get into. Like if you had a herniated disc and it was just smashing on the nerve, you might have to inject some steroid onto the nerve where the herniated disc is. But normally, even in that scenario, prolotherapy along with the nerve block can resolve the symptoms. But most radiculopathy that we see, pinched nerves that we see, all a person has to do is do prolotherapy. And again, we do prolotherapy anywhere from once every 2 weeks to once every 6 weeks. And mine, it was 2 or 3, it was 3 visits for the first time, 2 for the second time. And I'm back to swimming, running, doing everything.